Dr. Tracy, board certified general pediatrician, and I had a survey sent to me, and there was one of the questions I thought was really interesting and I thought I would share here. That was, if I could pick my ideal healthcare utopia, what would it look like? And I thought about this and I really wanted to give my answer, so I'll give it to you guys, and I'd love to hear your thoughts in the comments. But as a general pediatrician who has done ICU, emergency medicine, and now general pediatrics, not taking all insurances, now doing general pediatrics, taking all insurances, I have some pretty good ideas. So one of the things I would like to see, and I think there's a lot of evidence behind this, is a fully funded universal primary care preventative services in the United States, where every state funded every person that lives in their state for preventative care. That means that you can go to the dentist, get preventative care for your teeth, and that is covered by this universal preventative care. You can see a nutritionist, you can have a lactation specialist if you are a breastfeeding parent, you can have speech, occupational therapy, physical therapy, any kind of therapy deemed to be appropriate if there is a developmental delay. You could have access to your primary care provider. We would be better funded. We would be available. There's mental health care preventatively available in all social work, care coordination, home health. And an interesting thing that you could do in this case is to do some group preventative care. So one of the things that's kind of isolating in American medicine is that you go to the doctor or primary care provider, you're in the room alone. And so you're kind of getting this information, maybe you don't fully understand, you feel disconnected, you're not getting as much advice or experience. So in some places they do something called group preventative care or wellness care, where they do a bunch of 6-month-old babies together. A provider and nurse educator, sometimes the lactation specialist is there, nutrition is there. It's this group effort. And we get together, we talk about normal milestones, what is appropriate at 6 months, what are great ways to feed your baby. Everybody can give each other advice, and then each individual child gets their individual care. They talk about your specific child's growth patterns and then offer vaccinations at that point in time if they're due. So this is a great concept. This would save a ton of healthcare dollars, as well as I think lead to a more collaborative primary care approach. And this is really exciting to think about. And this is being done actually in several areas in the United States, and it's being done very well. And there's other countries that always do this. It's so interesting because the families will even bring clothes like, my baby's bigger than yours. It's a great way to collaborate and form community, because one of the things we notice impacts our overall health in the long term is lack of community. So if this was fully funded, if there was a way that every single person, I can talk more specifically about children obviously, had access to a quality primary care provider, had all of these things, and they saw it as a community, they saw it as something that was great to go to. Studies show this is less expensive than the current healthcare model, which is based on people being sick and individualized, often kind of isolating care. So I think this is super exciting. I'd love to hear all of your thoughts. Obviously, there's lots of different ways to do this, but for me, I think that would be so exciting. It would have felt better as a parent when my kids were younger, and as a primary care provider, it's one of the first things I've been really excited about in a long time, is the idea of that we all know that our healthcare system is broken. It is horribly broken. Everybody can agree with that on all sides of the aisle. So what we're seeing now, all of this disgruntledness, is because there's a broken healthcare system. So if it's broken and it's not working, then why don't we blow it up and make something better, make something that actually benefits everyone and promotes health, promotes wellness, promotes this community of raising our children together, all helping each other out so that we have better healthy outcomes. Every study shows this is a lot less expensive and a lot better outcomes in the long run. So again, are we gonna get this? I don't know, I doubt it. But it's super exciting to think about. I have to believe that all of this strife right now is because what we're doing is a mess, and this is a really good time to say, let's dream big and think of what we could want for our children. So take care, put your ideas in the comments. Again, be nice to each other. We all want things to be better. We don't need to be arguing with each other. Be nice in the comments, but put your ideas. I'd love to see what they are. Take care.